We are very concerned about the heart because we know if the heart stops, basically life ends. And we know that diabetes increases the risk of these complications. Dr. Llanos, could you describe how poorly controlled diabetes affect the heart?
So poorly controlled diabetes, I tell my patients, and I tell them, I'm trying to be dramatic here, but I do not wish diabetes even in my worst enemy. I don't have enemies, but I truly don't wish it on anybody. Poorly controlled diabetes affects multiple areas of the heart, especially it causes inflammation in the heart arteries that eventually leads to buildup of cholesterol and calcium. It doesn't happen overnight. It happens throughout decades of uncontrolled risk factors, but mainly diabetes. I'm going to get back to that, but diabetes also causes a stiffening of the heart muscle, which in turn leads to fluid buildup and what we call congestive heart failure. And the tricky part of diabetes is that patients with diabetes have development of heart blockages of heart disease at a younger age, more aggressive than people without diabetes, and more diffusely diseased. So it is extremely tricky to be able to prevent this. And I moved from Connecticut about 2.5 years ago when I were trained, and I have to say, and I echo Dr. Luna's, concern that the prevalence of diabetes in the Valley, it's extremely high. I have never seen so much heart disease in such young patients.
If a patient is referred to you by the primary care or self-referred by the patient, how do you evaluate if diabetes has affected the heart?
And that is a very common question, and I have multiple referrals for this. The main thing is talking to patients and first of identifying the risk factors. Diabetes, we know that increases the risk of having heart disease and heart attacks by 2 to 4-fold. So we have the same patient, same age, high blood pressure, same history of smoking, one with diabetes, one without diabetes. We know the patient with diabetes have a 2 to 4 times higher chance of having a heart attack and heart blockages compared to the one without. So we start by seeing the risk factors. How many years of diabetes have you had? How well controlled has it been? And other non-diabetic risk factors such as high blood pressure, cholesterol, genetics, smoking. Because sometimes patients come and they tell me, I'm 40, I'm too young to have any of this. I don't know why my doctor even sent me to you. And then I ask, how long have you had diabetes for? And they're like, oh, more than 20 years. But I don't need you. These patients told me, I don't need you. I only need a GI doctor. I'm having indigestion. And then that's a trick part of patients with diabetes. They don't have the textbook symptoms of the chest pressure that we see on the TV, the chest pressure, the cold sweats, people like grabbing their chest, the crashing. People with diabetes don't have that always. People can have feeling of tiredness, fatigue, getting out of breath that we attribute to age, being out of shape. I've gained a few pounds after COVID. It's not my heart. It's just I'm not being in my best shape as I've been. And unfortunately, many times diabetes can present like that. Just being winded, being out of breath, indigestion, very common patients with diabetes. And females also present with atypical symptoms. So I see the risk factors, I see the symptoms, and oftentimes when I ask short of breath, people say no. And then when I start diving a little bit deeper, it's like, what happens when you climb stairs? Oh, I get out of breath. So we start. There's stress tests, treadmill stress tests, nuclear stress tests for those who cannot run in the treadmill. There's CAT skills, an EKG, an echocardiogram. We look through and through the risk factors, and then ultimately the ultimate way to diagnose heart disease in patients with diabetes is a heart catheterization, which is an invasive way, usually through the wrist, to confirm whether someone has heart blockages or not.